So we bring together advocates from across the country for Patient Congress because it's important that they, A, get a chance to see each other in person and create that energy that being together and face-to-face can only create. But beyond that, the substantive part of it is really helping them share their story together and learn how to be powerful advocates both for themselves as well as for other patients and for their community and for the things that are important to them as well as us as an organization. And I think what that still boils down to at the end of the day, being able to tell your story and to communicate it effectively, and to the extent that you can put that into the context of something that's important from a policy perspective or from an issue perspective. So trying to help them connect the dots between what your experience has been and how to articulate that and how to connect that to an important issue of the day, whether it's palliative care or whether it's medical debt or whether it's step therapy or whether it's Medicaid. All of our volunteers have experience either as patients or in their communities, the work they do professionally as volunteers across a range of different issues. And so we're helping them, again, articulate what's important to them and what matters to them, because that really is that personal connection, but then being able to connect that meaningfully to really important issues that are on the top of mind of policymakers and thought leaders, as well as their fellow patients. Yeah, I think in a word, it's person-centered care. You might also call it the value agenda. There's been a great reawakening, if you will, of this idea of quality and value in the healthcare system, and so now we have some policy efforts to try to actually pay for value, which is a novel concept. And I'm being facetious there, but yes, of course we want to pay for value, but we've always paid for volume. So there's a pretty substantive and pretty aggressive attempt to try to shift the payment model environment so we're actually paying for quality and value. And when you do that, you have to stop and think about, well, what is quality and value? How do we actually pay for that? How do we know we're delivering it? And that creates an opportunity for patients, for us as an organization, for patients themselves to step forward and say, well, this is what matters to me in my care, and this is how I define quality. Not that that's going to become exactly what we pay for, but at least to help inform the conversation around what's the quality measure set that we want to use as a basis for reimbursement or incentivizing the clinical care system. What are the patient-reported outcomes that we want to use to measure how successful a particular treatment or care plan was for a patient? Well, it just so happens that their legislators are making policy decisions every day that affect the lives of millions of people, including their own. So I think it's important for their own members of Congress to hear from them directly about what's important to them, about how the decisions they're making are going to affect their lives every day and the lives of their fellow patients and their fellow volunteers and the people in their community. So it is, and of course the members of Congress want to hear from their constituents. They want to know what's important to them, and if you don't tell them, somebody else is going to. So they do want to hear it. They want to know what's important to you, but you have to be able to make that feel personal to them. They have to know why it matters to you personally. And so that's the value of being able to be an advocate for yourself. And again, that starts with whether it's in front of your member of Congress or whether it's in front of your care team or whether it's in front of your family members, to be able to articulate what matters to me. That's sort of I think a fundamental skill set and the starting point of any effective advocacy conversation. Again, whether you're advocating for yourself in a clinical setting or advocating on behalf of a particular policy, being able to say, what's my story, what matters to me, and then connect it to whatever it is you're trying to achieve in that context. So if someone asked why they should be a volunteer with the National Patient Advocate Foundation, I think for me, what I would tell them is we feel that the volunteers are the lifeblood of who we are as an organization. We can all we want, and we do try very diligently to speak for the voice of patients. But it's even more powerful when patients themselves and volunteers come and do that on their own accord and do that with us and for us. So we are National Patient Advocate Foundation, a staff of 12. We work and represent a larger organization at the Patient Advocate Foundation of 200, but we're limited in terms of how much voice we can have and how much impact that we can have as individuals. The real power in scaling the voice of the patient comes in the volunteer voice. So we love to have volunteers come engage with us and be able to represent the patients that represent themselves, but also represent the patients we serve. And I think one of the unique aspects of our organization and the voice that we try to bring to the table is that of the low-income, underserved patient. So a lot of organizations represent a lot of different types of patients, whether it's a disease or whether it's a particular stage of the disease process, survivorship, for example. We represent all patients, patients with chronic, life-threatening, and debilitating diseases that have a variety of different diseases, but the lowest common denominator in our patients and the voice that we want to be a voice, the patient population we really want to serve as a voice for is that low-income patient population that is really struggling to afford and access the healthcare system. So I think that's a unique opportunity for our volunteers to be able to engage in an organization that represents a variety of different diseases, but particularly represents a segment of the patient population that is highly unrepresented and deserves to be heard and have a voice in all these issues that are so important and affecting patients.